Hello everyone. Let's see, today is July 16th, it's Thursday. I'm Rendi Murphree, epidemiologist and director of disease surveillance here at the Mobile County Health Department, here to provide an update on the impact of the COVID-19 epidemic on Mobile County. Just again, around the world, over 13 million cases, almost 600,000 deaths, 3.5 million cases in the U.S. with almost 140,000 deaths. And in Alabama this morning, just over 60,000 cases with 60,158 and 1,200 deaths. In Mobile County this morning, we reported 5,570 cases of COVID-19 disease in Mobile County residents. That was an increase of 63 that we added just yesterday. And again, we've not been providing hospitalizations and deaths because there have been some adaptive changes made to our surveillance systems, and we just want to make sure that we have it as close to accurate as possible before we share those numbers with you. I believe we will definitely have this figured out by the time our weekly expanded report comes out on Monday, and you'll probably see those things included. But just to remind you, as we've been saying, that with this very accelerated phase of our epidemic, all systems are overwhelmed when it comes to COVID surveillance, to laboratory testing, to hospitalizations. We are just seeing an overwhelming of our systems because of the community-based transmission that's being driven predominantly in the younger age group. So I have quite a few questions to address. My system is also overwhelmed. It's very difficult for me to keep up, like all of you probably, keep up with the amount of information that's changing, to keep up with the phone calls that are coming in, requests for consultation or review. Keeping up with the number of complaints that are being reported to us, and so I've not been able to find a lot of time to research some of the answers for questions that I don't fully know how to answer, but I will do the best that I can. I wanted just to briefly mention the safer at home mask requirement that goes into effect today. Not sure what time. 5 p.m. Okay, thank you. So today at 5 p.m., the state health officer and the governor have signed a safer at home requiring masks to be worn. There's an exemption for children who are less than 6 years old. There are also a few other exemptions, like for broadcast, like we're doing today. That's why I can talk to you without my mask, because this is a broadcast. And there are other exemptions there for doing things like if it's difficult to communicate. A person who is voting may not have to wear the mask always, though it's strongly recommended. Some essential job functions like law enforcement, firefighters, and EMS, if it's just they're not able to wear the mask to do their job. So make sure that you read through that order to know if you are subject or allowed to not wear the mask for specific activities that are listed in the order. I think we went through the FAQs about the mask ordinance yesterday. Is that right? Okay. So I'm not going to go through that again today, but again, starting today, anybody over the age of 6 will be required to wear a cloth face covering or a face mask to cover your nose and your mouth when you're out in public. So again, just want to demonstrate that this has to be over your nose and it needs to cover your mouth. Usually if it's tucked under your chin, that's a best practice. But this is not protective, and this is a violation of the mask order. It has to be over your nose and cover your mouth. And for anyone over the ages of 6, and this supersedes any local ordinances, which includes the City of Mobile ordinance and the ordinance that the Mchd health officer placed over unincorporated areas. So everyone across the state, no matter where you are, starting at 5 o'clock today, must wear a mask when you're out in public. And wearing the mask does not excuse you from the 6-foot physical distancing. These are added layers of protection for you. So when we go through the list, like we need you to stay at home if you're sick, we need you to wash your hands, cover your cough, disinfect surfaces, stay 6 feet away from anyone not in your immediate household, and wear a face covering. Those things are not exclusive of one another, they're combined. So just because you're wearing a mask does not mean that you can move within 6 feet of someone who's not in your immediate household. So I want to make real sure, we've had some questions about that. So just want to make sure you guys understand. Okay, I will try to work these questions backwards, so bear with me. So a comment from the media about lines wrapping around the corner at an urgent care where COVID testing is being conducted, and you know, do we have enough testing in Mobile area? We have plenty of testing in Mobile, though it is getting harder to meet demand. For example, all appointments at Mobile County Health Department testing sites are filled for this week. If you want to make an appointment to get tested with us, the appointments are spilling over into next week. So that very much tells me that we have a much greater appetite for testing than we did when we first started, when we had plenty of spots available. Maybe the word is just getting out a lot more. I have a feeling that the long line wrapping around the corner was for people waiting to get the rapid test, the rapid PCR tests that only takes about 15 minutes to conduct, but you can only, you're limited with the number of tests you conduct per hour, because I believe it's like a 1 test per machine. So this is called the Abbott ID Now, and many people I hear are waiting in line to try to get that 15-minute result back, and that may be the reason that you saw some long lines. This testing platform is some places have it. We have one at the Mobile County Health Department. We're trying to get a couple more. It's favored by people who, you know, need a test result to get back to work and want to do that quickly. But there are still some restrictions under, you know, how we think that test is fully accurate, the timing of the specimen collection, you know, the timing of your exposure, all of those things matter. But the test is trustworthy, and yes, that may have been the reason people were waiting. Let's see, I mentioned that there are new quarantine guidelines on the ADPH website. Yes, on 7/13, ADPH updated their isolation and quarantine guidelines. If you will send Mark Bryant a note, I don't know who you are, I will send you a link, but yes, it's under the code. It's on the alabamapublichealth.gov COVID page. Click on the tab on the left-hand side that says healthcare providers, and then look at the list of links at the bottom of that page. And yes, it's available to everyone. Lots of questions about the bed capacity and the ICU capacity at our hospitals. I just heard a number that from Ames that we have around 250 people currently hospitalized who have a COVID positive diagnosis. And yes, our hospitals are filling up. They are still doing elective procedures and surgeries, but they have both COVID patients and non-COVID patients, and so far they feel like they're managing that well. However, they are cautious about staffing, as they have staff members who are exposed to COVID and have to be sent home. I think that will make it increasingly more difficult for our hospitals to continue performing elective procedures and surgeries. But for now, they are saying that they are managing. Okay, sorry, so about so many ums, but I just want to be real careful about what I say here, because I don't want to misrepresent what's going on. It's not good out there. The hospitals, the emergency departments, the critical care units, the ICUs are filling up with both COVID patients and people who are having non-essential surgeries it is concerning. Let's see. Hoping to give an update on how many complaints we've received on the hotline. I believe we do that on Fridays. We try to give an update. We get dozens and dozens every day. So we have a team that deals with complaints against permanent establishments, a team that deals with recommendations and consulting around infection control with healthcare facilities and long-term care facilities and congregate settings like group homes or detention centers. We have a team that is working with schools, colleges, and universities, and then we have a team that works with everyone else. So the shoe stores and the hardware stores and the salons that we get complaints about or get requests for consultation. So a lot of that is going on. All right, some questions in here from the media on the 15th asking about some comments made by Dr. Harris about Alabama hospitals at or near capacity. I don't know the 32 hospitals that he mentioned. We still do have IC capacity, but the hospitals are having to adapt to the large number of hospitalizations due to COVID and other reasons, and are extending their COVID units, or in some cases extending their ICU beds to other parts of the hospital. What is the biggest concern with a pandemic like COVID-19? Well, a big concern is we have a totally naive population that has never seen this virus before, so we have no immunity globally, worldwide, no immunity. We have no treatment and no vaccine. And yes, a big concern is that unmitigated transmission will quickly overwhelm our healthcare system, resulting in an extraordinarily high number of hospitalizations and deaths. That is why we began back in March recommending measures to try to slow the spread and flatten the curve to keep from overwhelming our hospitals. We did a good job of that in the beginning, but in the last 2 weeks, we've been unable to slow transmission to the point where I'm worried about overwhelming our hospitals and urgent care centers. Someone asking if the mask mandate is helping. It's too early to tell. The state health officer and governor mandate that starts today at 5 o'clock is a 2-week mandate. It goes through the end of July 31st, but it generally takes at least 10 days or 2 or 3 weeks before we can see the positive impacts of wearing masks on slowing the spread. Someone asking how many tests are being conducted per day. We don't generally talk about the number of tests done per day because it varies. It's like the number of cases reported. It goes up and down, and it's artificially affected by all kinds of things. I do report the number of tests that we learn about by week. So if you wanted to get an average number tested daily, you can do that by division. A comment or a request on Facebook about the Washington Post and New York Times articles that have revealed that the Department of Health and Human Services implemented some new data reporting tools which were expected, basically saying that data from hospitals would be going directly to the Department of Health and Human Services and the White House rather than going through the Centers for Disease Control. And the question was, do I think leaving CDC out will harm our tracking abilities as a nation? And I think that anytime you remove the nation's premier public health administration from the conversation, there is concern. I have concern about doing that. It may be that was a joint decision made that HHS would take on some responsibilities, leaving CDC to focus more strongly on others. I don't know what happened behind the scenes, but our case reporting and our laboratory results reporting is still the same protocol that we have had since the beginning of the outbreak. So let me address a couple of the media questions from today, and then I'll try to get a couple more Facebook questions. Let me look at my time here. So someone from the media asking if I could estimate, based on our data, how many people in Mobile County may have COVID-19 but haven't tested yet or don't know it. That's a really tough figure to get at, and it's hard to generalize, so I'd rather not speculate about that. And then also asking about herd immunity. There's been a lot of talk about herd immunity, and this is herd spelled H-E-R-D, so like a cow herd. The idea is that if you have enough cows in the herd vaccinated against a disease, that the herd immunity, or the immunity in the cows that are vaccinated, will protect all of the cows from getting an outbreak of disease. We don't know yet how much antibody, how much immunity a human gets from exposure to COVID. So if I get infected with COVID, yes, my body immune system is going to produce cells to try to fight off the infection and help me get back to normal health. Right now, we don't know how long those cells will last or how much protection they will provide. So that makes it very difficult to try to determine how many people need to get infected when and for how long until we reach herd immunity. We likely will not be able to reach herd immunity without a vaccine. We really need a vaccine. You know, we've not historically not been able to contain things like measles or polio or chickenpox, or, well, leave out chickenpox, influenza, you know, other vaccine preventable diseases, some hepatitis. We've not been successful in eliminating those. Smallpox is another good one. In eliminating those without really good, safe vaccines that are taken by a large community, a large proportion of the population. So it's unlikely that just disease burden alone would provide herd immunity for COVID. Someone asking about remdesivir. There have been some changes in the availability of remdesivir, the treatment that is used for the most sick, the most ill patients, patients that are in ICU. Remdesivir has proven to be quite useful for reducing negative outcomes and deaths in people who are hospitalized and requiring ICU. But the free remdesivir that was being provided by the Department of Health and Human Services has been depleted. And starting this week, HHS will be working directly with hospitals to fill orders of remdesivir, and I believe there will be a cost of that going forward. So that is also a bit concerning, and that we may not be able to rely on that life-saving treatment as heavily as we have been in the last couple of weeks. All right, I think I may need to stop there for now since we're kind of going long on time. The Facebook and other questions that we didn't get around to today, I will try to address tomorrow, and also give you the update on the number of cases that have been added. So thanks. Remember to be hypervigilant, wear your face covering, keep a safe 6-foot distance around others that are not in your household, stay at home if you're sick, wash your hands, cover your cough. I'm sure we all have this memorized by now, so please help us protect the community by following those recommendations. Thank you.